The University Hospital of Brooklyn has the staff, the technology, and the expertise. But its emergency department can't cope with the number of patients that come here for help.
All right, little pinch.
Have a seat right there.
Dr. Aragul says that part of the problem stems from people using the emergency room for minor problems when they should see a regular doctor.
This is a typical problem that, if she had a primary care physician, she'd be seen there. She should be seen, with her primary care physician, or they would have arranged some sort of physical therapy for her.
But Shelley Ann doesn't have health insurance.
Let me take a listen to your heart and lungs.
And for her, like for many of the almost 50 million uninsured Americans, going to a private doctor is too expensive. She got into an accident months ago and still has back pains. It's not an emergency, but she'll be cared for here.
If you're going by the private doctor, you're going to have an insurance, but for the hospital, you don't need insurance, You just come and you just get your treatment and you go home.
Situations like these have stretched emergency departments across America. We couldn't film the hospital's waiting room, but Dr. Aragul says the situation is critical.
It creates a sort of crisis conditions in the ER, and that's what we're living through right now. This ER or any ER around the country might be completely full, overflowing with patients. People who are supposed to be going upstairs have been sitting in the emergency department for 24 hours, sometimes 48 hours. It's a big problem. It really affects the care that we can give in the ER.
The U.S. has some of the best healthcare services in the world, but not everybody can access that care.
If you don't have money, if you don't have insurance, if you're uninsured, if you're one of the 50 million uninsured people in this country, then you're on your own. So it makes it difficult to get good health care if you don't have insurance.
I'd like to switch his mask.
Up to 70% of emergency room doctors support universal health care.
So everything's fine, right?
They are waiting to see whether a new health care policy under the incoming president will help the millions of uninsured Americans.
Do you take any medicine for your seizures?
And help Dr. Aragul give the top-notch care he feels his patients deserve.
You spent all night there. In the emergency room?
Kaufmann, Al Jazeera, in Brooklyn, New York.